trauma happens when the first time you surf is like going out in the middle of a tsunami. You're going to crash. There's nothing healthy about that experience. Whereas trauma therapy or brain retraining is like going back out on the water on a calm day with a coach and learning how to surf these little waves. And then you develop more tolerance, more capacity, more resilience, and you can handle more of what life throws at you with ease and skillfulness.
Hey, I'm Ben Ahrens, co-founder of Reorigin, where we teach people how to retrain their brain to reclaim their health. And in this interview series, we are thrilled to bring on Dr. Brian Plante to our podcast, who is a licensed naturopathic doctor specializing in integrative healthcare from the National University of Natural Medicine. Dr. Plante is renowned for his work in complex immune disorders and chronic conditions such as Lyme disease, environmental toxicities, and autoimmune conditions. At Amen clinics, he extends his expertise to neurological and psychiatric conditions, emphasizing a holistic approach to mental and physical health. Dr. Plante is passionate about empowering his patients through understanding and compassion and helping them navigate their health journeys with renewed hope and a sense of optimism. In this interview, we get deep into untangling some of the complexities of complex chronic conditions, including Lyme disease, MCAS, food sensitivities, irritable bowel disorder, PTSD, and many other conditions that fall under this umbrella of complex chronic or inflammatory ailments. We also talk about the brain's crucial role and how training the limbic system or brain retraining can play a really important role, not only in making a person more receptive and positively susceptible to the influences of healing and recovery, but also can start to tune down that stress response and really aid in a person's long-term well-being. Topics include the cell danger response, trauma responses, and how we can gradually expose ourselves through the use of pragmatic and, yes, redefined exercises, physical exercise, as well as brain retraining and neurological exercises to get ourselves back into a state where healing will naturally prevail, while at the same time we're able to make strides in the world toward fulfilling our true sense of purpose and most fulfilling life. I'm honored to have this conversation with Dr. Plante and hope you enjoy it as much as I did. Dr. Plante, I really appreciate having you here. And just getting started, I would love it if you could just introduce yourself, give a little bit about your background, how you came into the world of functional medicine and the Amen Clinic, and speak a little bit about the types of conditions that you commonly treat.
Yeah, super excited to be here. So I'm Dr. Plante. I am a naturopathic doctor licensed in California, and I was trained at Portland, Oregon at the National University of Natural Medicine. And I am very grateful for the naturopathic education that I got, because right from the beginning of our training, we were taught to think about how the whole body works together, and not just the body, but also our environment and the other elements of who we are as human beings. Some people will say, body, mind, spirit, environment, spirit, whatever that, means to you. There's lots of ways we could talk about that, but the way that the whole human organism is integrated and connects to other human organisms and the natural world at large was emphasized from the very beginning, which has proved to be very critical when it comes to helping people with chronic, complex, multi-system illness recovery. So when I did my residency in Lyme and complex immune illnesses, this was right when the pandemic was starting, which was quite interesting, being a first-year doctor in the middle of a global pandemic, which has never happened. And it was quite enlightening to see how many of the principles of how to manage and treat complex illness that we were already treating were starting to also apply to some of the earliest stages of earliest cases of long COVID that we were seeing. So the thinking about complex illness, getting that residency exposure with Lyme and related conditions, the pandemic happening, and then the underlying naturopathic training has really kind of positioned us to think about how best to support these conditions when conventional medicine unfortunately seems to really be scratching its head.
Yeah, and I think you hit on something really key, which is just like the full spectrum view of the human being, the human organism, including the full context there. I'm just curious to know what led you down that path of integrative and functional medicine as opposed to taking a more narrow view.
Yeah. So when I was in high school, I knew that I liked science. I was taking a chemistry class and I was like, wow, I like thinking scientifically. This is something that I'm good at. This seems like a fruitful career path to consider going down, but I wasn't quite sure if I wanted to do clinical practice or medical research. Some people say when they're kids, they knew they wanted to be a doctor. That was not the case for me. In fact, I often joke that I never went into medicine because I wanted to be a doctor. I went into medicine because I wanted to facilitate healing. And so when I was in high school thinking about these questions, I remember reading a book. I don't even remember what the book was, but the author was talking about how her brother was a healer. And I became really gripped by that word. I was like, what is that? What does that mean? What is a healer? What is healing? I knew about some of our issues in conventional healthcare. And I just did a quick search, medicine and healing, and found the page on naturopathic medicine. And it said, do you have the mind of a doctor and the heart of a healer? Do you want to help patients by facilitating the healing power of nature, which exists within our bodies as the drive toward homeostasis and tissue repair? Do you want to emphasize prevention? Do you want to treat the whole person? Do you want to be the teacher? The Latin root docere, from which doctor is derived, actually means teacher or educated one. And so I loved the idea of being a teacher and a facilitator and influencer now means something different with social media, but influencing people in their health journey right from the get-go, as opposed to this kind of more passive model that conventional medicine advocates for, where the doctor is the doer and the patient is the recipient of care. So I felt very fortunate to discover the field of naturopathic medicine, which is still a relatively small profession, quite early in my life and early in my career, and didn't have to go through the arduous journey that a lot of my medical doctor colleagues did, where they got burned out through the conventional healthcare system and went through a period of disillusionment and then discovered functional med. I was lucky to kind of have it exposed early on, and it resonated with my value system.
Yeah, certainly. Influencer has taken on a different tone, but I think the idea really resonates that when people go to see a naturopathic or a functional medicine doctor, they're really being an active participant in their own healing. So share a little bit about what types of conditions you see commonly, how those might differ from what people typically go to for a mainstream doctor. And then we'll get into one of the main focuses of this conversation, which is really the role of the brain and things that people can do, or to what extent, I should say, people can really have an influence over their own health and healing process.
Yeah. So as naturopathic doctors, we were trained as primary care physicians with an emphasis on more chronic illnesses that are not always addressed by conventional medical tools. So this could include things like thyroid or adrenal issues, digestive disorders, other hormone imbalances, as well as allergies and asthma and eczema and things like that. But what was really interesting to me, kind of from the early stage, was Lyme and chronic complex infections and mold toxicity. And I didn't get a whole lot of training on that when I was in school. It wasn't until residency in the Sacramento area of California where I saw a ton of cases of Lyme and co-infections that were not, there was a huge need for doctors in that to serve that population in that region. There's a lot of misconceptions about how prevalent Lyme is in California. And so that was when I got exposed to not only the fact that there was a population that really needed that support, but also that you had to use all of your conventional medical training and your naturopathic skill set to be able to support these patients, because oftentimes they did have hormonal imbalances, digestive issues, mental health conditions. I was always really passionate about working in mental health care when I was in med school. And so it was like you had to be able to work with every organ system of the body when working with these complex cases. So now I would say not just doing psychiatric and mental health cases at Amen clinics, but the complex chronic illness umbrella, which would include things like Lyme, co-infections, long-haul COVID, chronic viral infections, mold toxicity, heavy metal toxicity, dysautonomias, including things like POTS and low blood pressure and adrenal issues, as well as the more nuanced, difficult to treat conditions like mast cell activation syndrome and multiple chemical sensitivity syndrome. So all of those have some similar features. They're slightly different, but they kind of fall all under the umbrella of chronic complex illness, which is really where I'm specializing and focusing these days.
What do you do when someone comes to you or to the clinic and they're exhibiting all of these different symptoms that that you described? And it's not uncommon for one patient to exhibit many of these different symptom clusters, right? And sometimes it starts off as a Lyme or fatigue, and then can segue into sensitivities and food sensitivities and all these kinds of things. So let's just say the average person or average person that you might see is coming to you with all of these different expressions. What's the first step? How do you start to unravel this?
Yeah, so there's a couple of different angles that we may take depending on the severity of the case and what they're coming in with. But one is, what is the area of dysfunction that is most in need of support? So, for example, if someone's saying, well, I'm in severe pain, or I'm severely constipated and I can't have a bowel movement more than once a week, very specific individual symptoms, we may focus more on that initially. But the question that I'm always asking when it's the kind of the eight-headed beast, so to speak, they've got POTS and dysautonomia, they've got mast cell activation syndrome, they're having digestive issues, that we know they have Lyme or co-infections, or we suspect that they might, is we're trying to trace those branches of the tree down to the trunk, to these common features of imbalance that permeate the entire system. Usually that's going to look like some sort of limbic activation, some sort of sympathetic versus parasympathetic imbalance in the peripheral nervous system, issues with absorbing nutrients, and issues with detoxification, as well as immune dysregulation. And so when we boil it down to those common features, we can say, okay, what can we do to support each of those categories in a way that is comprehensive, but not overly complex or overwhelming for a patient in terms of how many things to take or things like that. But we're kind of building a multi-level mansion, as I explain it to patients, where those first couple of visits, we're pouring that concrete foundation. We're figuring out, okay, where are the imbalances and where do we need to, get our broad strokes first. And then we're getting more nuanced with some of our testing or some of our individual, treatments. But those are the sorts of things that we think about. What's most disturbing to function and quality of life now, and what are the patterns of imbalance that we can apply to these different categories of dysfunction?
Yeah. I think when a lot of people think of Amen clinics, they think of the brain, and they think of these images of brain scans and SPECT scans and things like that. And one of the questions that came up from the Reorigin community was, what are some of the key takeaways that you have from just maybe a better understanding of chronic conditions by looking at brain scans?
Yeah, so the type of imaging that we use is called SPECT scanning, which is a type of CT scanning that measures blood flow to the brain. We get a regional map, both the surface of the brain as well as the internal structures, the limbic structures, and the cerebellum and other related internal structures in the brain. And some of the common things that we see are global reduction in blood flow. So it might look like there's a bunch of holes in the brain. Now, this doesn't mean there's actual holes in the brain. It just means the threshold of blood flow needed in order to fill in that color in the image is reduced. And if we see that global diffused, a scalloping pattern, as we refer to it, that's when we're kind of a little bit on high alert about, could there be some sort of inflammatory trigger or something that is reducing blood flow, like iron deficiency anemia or untreated hypothyroidism. The downside with that type of imaging is it's not specific without getting the history. So we can see that there's an inflammatory pattern or reduced blood flow, but we don't know what's causing it until we start to ask some of these deeper questions. But folks with chronic multi-system illness often see changes in those patterns. We may also see a significant reduction in blood flow in the frontal lobes, which is involved in planning, organizing, attention, impulse control, our ability to initiate, and we may see issues with the temporal lobes as well, which are important in regulating mood and emotion and memory. So especially in our neurodegenerative cases, we see a lot of reduction in temporal lobe blood flow. But I also like that we can see the limbic system. So folks who either have PTSD or severe chronic illness like mast cell activation syndrome or multiple chemical sensitivity syndrome, we often will see those limbic structures, the hypothalamus, the basal ganglia, and the anterior cingulate very lit up. We call it a diamond plus pattern because it kind of looks like a diamond, and you see a little bit of that temporal lobe involvement as well. We don't see that every time, but a lot of times when we do, it gives us even more evidence to say we really need to target regulating the limbic system if we're going to see long-term recovery here.
Yeah, so could you speak a little bit to that? Because that was one of the questions that came up most prominently from our members. And a lot of the questions are specific to conditions that they're struggling with, some of which you mentioned, PTSD, MCAS. But we have, some of these conditions fall, at least by conventional standards or viewpoint, they fall more on the spectrum of psychological, emotional. Other ones like MCAS and food sensitivities fall in, at least in our minds, more in the realm of physical or sensitivities and things like that. Could you speak a little bit more to the interplay and the role of the brain, how these conditions affect the brain, and in turn, how the brain and the limbic system influence or impact these conditions?
Yeah, so the most important thing that we need to remember about the brain is that it is an organ. And that kind of goes without saying, but it's amazing how often we still, in our modern day, talk about the mind and the body as if they were separate things. But the brain is an organ that is both hardwired into the rest of the body and also wirelessly connected to the rest of the body in terms of the blood-brain barrier, the lymphatic system, the blood that flows into the brain, and how what the chemical environment in the rest of the body can do when it comes in contact with the brain. And there are several mechanisms by which what is going on in the rest of the body influences brain function, both in terms of brain cell function and how disturbances there can cause neurocognitive symptoms, but also regional brain structural changes and rewiring of the brain in maladaptive ways. So some of those mechanisms include neuroinflammation. So immune cells in the brain become activated, and that generates free radicals, reactive oxygen species, and that can disrupt nerve cell transmission, electrical impulses from cell to cell. It can affect neurotransmitter production, so things like serotonin, which is important for mood regulation, dopamine and norepinephrine, which are important for focus and motivation. And then there can also be disruption to the blood-brain barrier. The blood-brain barrier's job is to try to keep things out of the brain that are not supposed to be in the brain. But if damage to that filter occurs, you can get more immune cells, more pathogenic microbes, and more inflammatory molecules into the brain, which kind of keeps the fire burning. It's like pouring gasoline on a fire. Mm-hmm. Individual pathogens can create toxins that cause damage to neurons and immune cells in the brain, such as LPS, which is a bacterial toxin on the cell wall. So there's a direct toxicity to nerve cells that can occur. Also, when inflammatory mediators are really high in the brain, it can lead to an overproduction of glutamate, which is an excitatory neurotransmitter, and we call that glutamate excitotoxicity. But it can occur in more extreme cases in seizure disorders where damage to brain cells is the result of excess glutamate. And along that journey, patients are going to be experiencing anxiety and insomnia because that glutamate triggers that. Also, we mentioned blood flow, and what I didn't mention is clotting. So if someone has chronic infections, their blood is often a little bit thicker, which means you're not going to get as much blood flow into those tiny arteries and veins in the brain, which means less oxygen delivery. It also means less toxin removal or waste removal. And so that combination of mechanisms, as you can imagine, is a perfect storm for nerve cell dysfunction. And the longer this occurs, it can actually lead to rewiring of brain circuits in maladaptive patterns, meaning more sickness behaviors, more depression, anxiety, insomnia. And then that affects our physiology as well. And it just ends up becoming this positive feedback loop that, when not interrupted, makes it really hard to get well.
Classic vicious cycle. I think that's one of the things that I know so many people struggle to grapple with, or to wrap their mind around, is how something like a pathogenic infection like Lyme disease, bacterial infection, might involve other co-infections as well. But how can something like a bacteria go on to make these changes in the brain and lead to all of these symptoms that seem totally unrelated, right? And then how can something like brain retraining actually feed back or influence something like your internal environment in such a way that can actually change its hospitability to pathogens? So maybe you could speak a little bit about that interplay between like the brain and the role of pathogenic infections.
Yeah. So, like I said, we've got the potential bacterial endotoxins. We've got pro-inflammatory cytokines, which can cross the blood-brain barrier, and we can have damage to the blood-brain barrier, all of which can, influence how the brain is functioning. We can also have some of these infections infect, not just affect, but infect the vagus nerve, which can affect not just the central nervous system, but the peripheral nervous system as well. How we govern autonomic functions like breathing, heart rate, blood pressure, and temperature regulation. So some of it can be the direct result of those inflammatory activities in the body. Some of them can also be related to the hypothalamus. So there's this region in the brain called the hypothalamus that is centrally located, and its primary job is to regulate homeostasis, or balance in the body. And when the hypothalamus starts saying, hey, we're getting all these signals that are suggesting there's some sort of inflammatory stressor, that can have effects on how the hypothalamus interfaces with the pituitary gland, which is a hormone-producing gland coming out of the brain, and then how the pituitary gland interfaces with the adrenal system, the thyroid system, and the sex hormones or reproductive hormones. And so by impacting the brain and the hypothalamus in that regard, we can start to see all of these downstream effects on physiology. And adrenal function is important for reducing inflammation, for keeping us energized, for keeping us sleeping, and not being too stressed. Whereas, with reproductive hormone imbalances, we can see menstrual imbalances, we can see low testosterone. All of these things also affect the brain. So it creates, again, another cycle like that. With the limbic system and the amygdala, the production of stress hormones like corticotropin releasing hormone have effects on those hormonal organs that we were just talking about as well. And so if there's dysfunction in one area, it doesn't take much for there to become dysfunction in these other areas as well.
So what are some of the critical factors for success that you see in patients who really overcome these kind of conditions long term? And we know that it's a process. It takes time, and it takes a lot of different approaches, never just one thing. Support of the physical systems, and like you mentioned, identifying some of those low-hanging fruit or most pressing issues, whether it's digestion or sleep or excretion or things like that. But yeah, in addition to those, ways of supporting someone on the physical level, what have you seen be kind of really crucial to making and sustaining a long-term recovery?
Yeah. So the kind of categories of dysfunction that I refer, or I should say, things that contribute to our toxic inflammatory overall burden: infections, environmental toxicants, any kind of trauma, so mechanical head trauma like injuries, traumatic brain injuries, as well as unprocessed psychological and emotional trauma that kind of keeps that fight or flight fire burning. And then nutritional deficiencies, sleep apnea. I see a lot of sleep apnea that doesn't get diagnosed. Those are some of the kind of initial things that I'm asking people about that are usually under acknowledged. Maybe they've worked with functional med before and they know there's digestive stuff that needs support. They know there's hormone stuff that needs support. It's not to downplay how important those are, but the other areas where until we remove this obstacle, we're going to have a harder time getting better. Those are some of those things. And so what does treatment look like typically from a comprehensive standpoint? It looks like trying to rebalance or modulate the immune response. So we're reducing inflammation, but boosting the body's ability to fight infections. It looks like giving the body the nutrients that it needs in order to make neurotransmitters, to detoxify, to regulate the immune system. It looks like treating any sleep disordered breathing, like sleep apnea, so they're getting the oxygen that they need to not only sleep well, but have their immune system functioning properly. And then the psychological and emotional trauma one is a little bit of a tricky one to talk about in these kinds of complex illnesses, because a lot of people have been gaslit by their conventional medical providers to think that these illnesses are not really happening, that they're primarily psychological or psychogenic. And that's not what we're saying here. But what we are saying is that when the brain issues are not addressed, they're going to be impacting all of these elements of physiology. And so a lot of folks, I do refer to a trauma specialist for EMDR or brain spotting or somatic experiencing, and sometimes even neurofeedback as a way of trying to rewire the brain with as comprehensive of an approach as we can, so that we're increasing frontal lobe activity, we're reducing amygdala activity, and then the other things that we do from a functional medicine standpoint are able to get traction. Otherwise, in my experience, it seems like we're fighting an uphill battle. They may be doing antibiotics, they may be doing nutrients, they may be doing detox, they may be doing all these things for years and not getting better. And that's where rewiring the brain becomes absolutely central. But it's always a part of a larger plan.
Yeah, and I'm glad you brought up and hit on like the really good point that when we talk about rewiring the brain, or we talk about even just that total load, it's not to discount the physical stuff that's actually going on in the body. In fact, it's all physical in some respect. It's just that this total load, the trauma, the environmental, the psychological, emotional stress, all of this buildup, and then the brain's propensity to rewire itself in the face of extreme stress, in a way that perpetuates inflammation and fight or flight type of activity. That is something that gets set in motion, not on a psychological level, but on a neurological level, and impacts basically the body's capacity to heal on all levels. So maybe speak a little bit more to like the brain retraining and the continuity. And I know you and I met through Lindsay, a mutual friend, and you've kindly referred a lot of patients to Reorigin. So yeah, what do you see insofar as like continuity of brain retraining as being part of a regular healing program? Where does that fit in? Who does it fit in for? Is it right for some people and not right for others? And yeah, maybe speak a little bit more to that.
Many of the patients that I see that are debilitatingly sick with chronic complex illness don't tolerate a lot of medications and a lot of supplements. Even things that would be, considered to be beneficial for physiology often trigger a detox reaction. And we're not even talking necessarily an aggressive detox protocol or an aggressive antimicrobial protocol. And so their menu of things that they can tolerate is very limited. And one of the things that I've seen over the years is that by doing limbic retraining and regulating the nervous system first, is that we broaden our therapeutic options in terms of some of the other tools that we can use. So for me, kind of getting into the brain retraining space started as being very practical, of feeling like as a clinician, my hands are tied behind my back. I'm limited to only being able to use a few tools. But if we get the nervous system regulated, we stop triggering that cell danger response as easily, and we're able to do more. So that's one component of it. The other component of it is the mast cell activation syndrome, multiple chemical sensitivity syndrome, EMF hypersensitivity syndrome, some of these conditions that really lack a solid understanding of what therapeutic interventions are helpful, seem to have a very significant limbic component. And in addition to brain training, I've used psychiatric medications in safe doses at low, non-addictive doses to help calm the limbic system. We do things that are anti-inflammatory to the body to help regulate that cell danger response as well, which often seems to calm down the limbic system. So it's kind of this ping pong match between the immune system and the sort of cell danger response, which is more systemic, and the limbic system. And so if one's activated, the other's getting activated. If the other one calms down, we don't have to work as hard on calming down the other one, so to speak. And so there's very much this yin and yang harmony between the brain retraining and everything else that we do. Sometimes we just have to do it or we're not going to be able to use any tools. And other times it's a matter of we're doing all of the tools. You're not having die-off reactions or detox reactions at all. We're just not getting any traction. And usually we find that patient is in an ongoing state of fight or flight, is having a really hard time regulating their emotional state. And by regulate, we don't mean control. We just mean being able to surf the waves up and down of life without feeling like we get overwhelmed or go into shutdown. And we're just not taught how to do this as a culture. That's why many of us as adults are learning this out of necessity, when really a developing brain should be taught how to do this when we're very young, so that when we are older, we're able to get out of fight or flight and to rest and digest. So we could probably talk for an hour just about that, but there's definitely, I think about it as that ping pong. It's like it's going to either escalate louder and louder if they're not helping, or if we manage one, it becomes much more manageable to manage the other.
Right. It's like the brain retraining and sort of turning down the volume knob on the limbic system, and that limbic activity can open the door to make certain treatments more effective and shut down the cell danger response, or allow the system to relax and release and even detoxify. And then at the same toll, it's like even if the body is maximally supported on the physical level, and a lot of problems or things that were contributing to the problems are eliminated, if the brain is not retrained, it will stay in those hyperreactive patterns. And so it kind of like happens on both sides. Now I'm really intrigued by that last thing you said, and would love to have you just share a little bit more on your thoughts of like what is really the goal of brain retraining. Because I know when a lot of people think about it initially, and now on the interwebs and elsewhere, there's so much talk about nervous system control and self-regulation and everything, and there can be this kind of mentality of like, I need to control the system, right? I need to be the one who's controlling the operating system, when in reality, the operating system, the brain is it's responsive to new inputs to control on some level, but really the goal is not to perpetually give it those new inputs. It's to restore its ability to self-regulate. So maybe talk a little bit about that, like, what it means for the brain and body to self-regulate, and how do we get it to that point?
Yeah, so there's this amazing concept from psychotherapy that I talk with patients about all the time called the window of tolerance. And the window of tolerance is the idea that there's a particular range of hyperactivation, or, you could say mobilization of stress response, of the stress response, and an appropriate level of hypoactivation, or shifting into more of a rest or, like daydreaming stage, for example. And there's going to be ups and downs of that, because we are human beings. Our brains and our bodies adapted and evolved to be in an environment that is constantly shifting. Our ancestors endured long periods of time without food, and the stress response that they experienced was motivating them to go seek out food. Or when you encounter a predator in the natural world and you have to fight it off, or run away from it, it's an adaptive response to be able to mobilize those resources, open up, that adrenaline receptor pumps, the heart rate up, opens up the lungs, moves blood away from the digestive organs to the muscles so that you can run away or fight. These are adaptive and healthy responses. And I think in our culture of hyper control, we often hear the language of, I need to learn how to regulate my nervous system, as I need to control my emotional state so I can be like a Zen monk and flatlined. But what we really want is to be able to be adaptable to whatever circumstances we find ourselves in. And we may not be finding ourselves in forced famine in the developed world, or, running away from predators, but there are, situations in which it would be normal and expected to be stressed, such as a grief reaction to a dying or recently deceased family member, or a major breakup causing a significant emotional response that's pulling us inward to kind of take care of ourselves and be less focused on the external world. So I think for me, in my own personal health practice, I've had to remind myself that this is not about transcending my humanity. It's about becoming more and more at peace with and accepting my human experience, while still doing everything that I can to turn the volume down on the extremes, which would be outside of your window of tolerance, either in the hyperactivated form, which looks like anxiety or panic attacks or irritability and rage, or the hypoactive, which looks like dissociation, apathy, an inability to enjoy pleasure in the things in life that we previously had enjoyed. These would be extremes that are not really sustainable for us as human beings and not really adaptive to our full health and full expression of ourselves. So I find that a helpful model because it's about learning to surf the waves. And I say trauma happens when the first time you surf is like going out in the middle of a tsunami. You're going to crash. There's nothing healthy about that experience. Whereas trauma therapy or brain retraining is like going back out on the water on a calm day with a coach and learning how to surf these little waves. And then you develop more tolerance, more capacity, more resilience, and you can handle more of what life throws at you with ease and skillfulness.
Yeah. Yeah, that's a really good framework, to think about it, because I think it's a lot of times our minds get very binary around these types of questions. And on one side of it, there's the extreme that stress is to be avoided, that we should not be going into the sympathetic state. On the other side of it, there's like the flatlining, that you mentioned. And I think really what it comes down to in a way is acknowledging that stress can be adaptive. It just needs to be kind of dosed properly. And if it was overdosed at one point, outside of our control, well, the solution is not to avoid all future sources of stress. It's to go back and kind of gradually re-expose ourselves within that window of tolerance in a way where the brain can kind of re-engage the gears and learn to smoothly adapt to stress in a way that is, well, adaptive, as we say, instead of maladaptive.
Or even healthy. I mean, there's research that talks about use. It's called eustress, EU stress, positive stress that is good for us. The most clear example of this would be exercise or cold exposure or sauna. There's research behind all these as being incredibly adaptive and healthy for our optimal function, but our ability to be able to do them is often contingent on these other factors. And I think the word that it kind of all boils down to is safety. Can I experience a sense of safety in my own habitat, in my own body, and in my environment, no matter what the stress is that's going on around me? And what I love about certain trauma therapy approaches, in addition to the brain retraining, is it's all about expanding our capacity to feel safe, so that we can do those hard things like jumping in the cold plunge.
Yeah, I think what you said just there actually really is significant. That phrase, expanding our capacity to feel safe, right? Because that's really what it is. It's ultimately like expanding our range of motion. We ultimately want to be able to feel safe and feel at ease, not flatlined. We want to be able to feel the fluctuations of excitement and other things, but within that window of tolerance, while expanding our range of motion, out into the world effectively. There's this book, Run Toward the Danger, I've spoken about on this channel before, where the author, Sarah Polley, she was suffering from post-concussion syndrome, and all of the well-meaning doctors that she had seen gave her the advice to withdraw from or avoid the things that were challenging or triggering her symptoms, which were headaches and migraines and sensitivities and things like that. And so following their well-meaning advice, after, a few weeks or a few months, she found that her whole life basically consisted of her being in a dark room because she had really not challenged or expanded that window of tolerance. In a sense, the window of tolerance had contracted to meet her actions. So she was almost training or reinforcing to her brain that, yes, these things are in fact, threats, not just challenges, and you should actually continue to withdraw from them. And her world, in effect, got smaller and smaller. And I think one of the big things that the aims of brain retraining or trauma therapy or these things is to, as you mentioned, to kind of gradually broaden that window of tolerance so that we can maintain that sense of safety. And I won't say the word control, I'll say like sort of self-regulation, but with respect to the inevitable challenges that the world is going to throw our way. At the end of the day, our health, I think, is really meant to be used. It's not this thing that's meant to be kept in a glass chamber. The reason that we're out to restore our health and part of the process of doing that, involves necessarily going out into the world and expanding our life in ways that are meaningful.
There's this meditation teaching that says it's not about how many times you get distracted from whatever the object of your meditation is, being present, staying with your breath, whatever. It's how able you are to come back. And I find that really applies here. It's not about, like you said, not getting stressed. It's about how and regulating our nervous system is really how able are we to come back to a parasympathetic, restful, easeful state from an appropriately activated sympathetic response with ease. Because if we find that we get stressed, but we're stuck there, we can't come back, then that's difficult to be regulated for.
I want to ask you about physical exercise as we're talking about things like emotional flexibility and cognitive flexibility and a certain flexibility of the nervous system. I'm curious to know if you've seen crossover, sort of transferable effects of physical exercise to the brain's ability or the nervous system's ability to sort of shift gears. And if so, what types of exercise you've found to be most effective for patients recovering from chronic conditions, knowing that a lot of them suffer from things like post-exertional malaise. And if they're, if they push themselves too far physically, it can easily lead to a little bit of a pushback that they then need to recover from. So how have you seen them kind of working their way back into physical exercise, and what effect have you seen that having on their, nervous system health?
Yeah. So this speaks to I'll just kind of tee this up by saying that it speaks to the delicate dance between expanding our comfort zone and doing things that are challenging, and then, radical self-acceptance, accepting our experience, being kind and compassionate to ourselves, not pushing our comfort zone, and knowing when to rest. And it's not always clear until you start to develop your intuitive inner compass and get that feedback from your own body about, oh, I think I overdid it. Or, you know what, I'm kind of lying to myself. I need to expand my zone a little bit and do something that's hard. But for people with severe post-exertional malaise, I often recommend starting with something like Qigong, which is it comes out of the Chinese medicine tradition. It's like a very, very slow, deliberate form of Tai Chi. There's these very fluid motions. There's videos online that are on YouTube that are 5 or 10 minutes long, like a morning Qigong exercise. And what I like about that is it's a more, most of the exercise in the United States that we do is very dispersive of energy. We might call more yang from a Chinese medicine. High intensity interval training, weightlifting, fast, steady state cardio. These are things that are going to dissipate energy rather than really gather and ground and build our reserve energy. And with post-exertional malaise, one of the challenges is people have, from a more holistic perspective, people have energy in the immediate sense to do the exercise, but they lack the reserve energy needed to really recover. And so they do the exercise, they're like, I feel great, I'm doing this exercise, and then they crash. And so what we want to do are more yin, more restorative, more gathering energy exercises like Qigong, Tai Chi, or even gentler forms of yoga, or walking. Walking can be dispersive, but it can also be, regenerative. You're walking on the grass and you're walking leisurely, and there's meditation as part of it. But things like that, you really have to kind of assess what is your capacity. And if I need to start with something much gentler, that's okay, but I need to move my body as much as I'm able to do, at least on a daily basis, or we're going to be limiting ourselves in terms of circulation and things like that. But you have to be gentle with yourself. As capacity starts to expand, we start to see more benefit from the hormetic stressors. We call it hormesis, where a little bit of stress causes a response in an organism that's a very beneficial thing, like more standard forms of exercise in the United States. And those have a neuroplasticity effect as well, in ways that increase our willpower. Parts of the brain associated with determination and tenacity increase their volume when we engage in hard things voluntarily, which I think is really fascinating.
Right.
Andrew Huberman talks a lot about this. And I experienced this this is just kind of a personal experience that I had the other day that was really eye-opening. That kind of speaks about the reverse, which is when we heal our limbic system, our capacity to do hard things also increases. So I've been doing a lot of trauma therapy, a lot of neurofeedback lately, and it's been a few months since I've done cold plunge. And I remember the last 2 times I did it, like I wanted to do it, I wanted to like it. There was so much anxiety that it was like, wow, I feel like I'm gonna have a panic attack in the water. And the other day, last weekend, I got in the cold water and like 2 minutes went by and I was like, I can do this. Like this doesn't, like not just I'm thinking I can do this, but like this embodied, grounded, powerful recognition of like, this is something totally within the realm of my capability. And it was really kind of an eye-opening experience. I was like, this was not how it felt before. What changed? And so there's, again, going back to that ping pong analogy, this dynamic interplay between what our limbic and emotional capacity is and what our physiologic capacity to go into sympathetic, which cold water and exercise will do, and shift out of it back into rest and digest without either getting overwhelmed or burning out, which is what the post-exertional malaise essentially is. So it's both.
Yeah, it's super interesting. And we see this a lot, these things that small practices, including, things like a person's self-talk of telling yourself, I got this, how much that the transferable effect that has of your ability to even face things that are physically uncomfortable or that would that you would be much more apt to avoid doing in the future, but how just retraining your brain or getting a few positive reps under your belt. We talk in the Reorigin program about the science of small wins, even if they have nothing to do or are totally unrelated to some other endeavor that you're trying to accomplish. Getting those little wins or those little reps, kind of racking that up, does seem to induce a certain amount of momentum that makes it much easier to approach difficult things. So yeah, I'm glad to hear that your experience mirrors that as well. It's just endlessly fascinating.
Yeah, and we know that the prefrontal cortex has an inhibitory effect on not only the limbic structures, but the sympathetic nervous system as well, and inflammatory signaling molecules, things like that. And so if we can celebrate those wins, strengthen this part of our brain, it has a downregulating effect on all those other things, which can allow you to do the exercise, do the hard thing, and not feel overwhelmed by it.
Fantastic. Awesome. Well, Dr. Plante, I really appreciate you coming on and chatting with us. We could branch off into like 100 different directions from that conversation, and I hope to have more conversations just like this in the future. Is there anything else that you wanted to share or anything that comes to mind that you think would be a nice addition here?
Yeah, I think what I would end with is just the way when our brain is really activated in that stress response, it feels like the experience we're having in that moment is going to last forever or has lasted forever. And that can be a really despairing place to be. And I just want to offer some encouragement after years of clinical practice and in my own healing journey. This can take a while. This can take longer than for those of you listening in the United States, as we as Americans, or just Westerners in general, then we're comfortable. It takes longer than we're comfortable with, but recovery is absolutely possible. And these subtle shifts in these different domains of function that we talked about today is what is required. And our mindset that even though I'm having this experience right now and it feels like it's going to last forever, even though I don't know how I'm going to get better, don't give up. You can get better with the right support and the right tools and the right things that help, reorient, set these different elements of our physiology. But it does take time. And I think if I could go back in time and change the way that I practiced earlier in my career, or just had other people in my care team be honest with me about that, say, Brian, this is going to take a lot longer than, I'm not a very patient person. This is going to take longer than you want it to take. But it requires, taking incremental steps and celebrating the little progress that you've made, as we mentioned a minute ago. It's so crucial. So I want to give hope, but also a realistic understanding of the timing that is often necessary in conditions like this.
I really appreciate that sentiment. And for anyone that might be feeling discouraged or finds it a daunting prospect to retrain your whole brain or undergo a whole new way of being, ultimately to pursue a healing path, yes, it's a process. Yes, it takes time. At the same time, it can be broken down to just taking the next step. And interestingly enough, when we accumulate enough of these steps, it is pretty remarkable, to what extent we can dramatically shift our entire body and experience. So thank you so much for coming on.
My pleasure. Thanks so much. I look forward to continuing conversations.
Likewise. All right, Ben here again. I hope you found that interview as helpful and useful as I did. If there's any questions that you have, if there's more questions or interviews like this that you'd like to see, as well as other guests that you'd like for us to have on this channel, always look forward to hearing your comments and feedback. So please leave those in the comments section below. If you'd like to find out more about the Reorigin Brain Retraining Program and learn some of the implementations of the tactics and tools that we spoke about in this interview, you can look up re-origin.com or just click the link below this video.